He is owner and director of Well Again Healthcare Center, medical consultant, and special interest in integrative oncology. 1996 Advanced Diploma in Medical Science, IMU, Malaysia. 1998 Doctor of Medicine, MD, UWO, Ontario, Canada. 1999 Medical Officer, Malacca General Hospital and Surgery, Anesthesia, Intensive Care, Obstetric and Gynecology, Pediatric. I request Dr. Ajit Kulkarni sir to please welcome Ken Yong sir. Ladies and gentlemen, please round of applause. Thank you.
Slide that I share my journey in the past few years that I ventured into integrative oncology, and by training I have an anesthetic background training in anesthesiology, and I was working in the intensive care and also looking at private practice now, seeing patients. I'm not a homeopath, I'm a hardcore allopath. Scientific, practical, integrative approach to cancer treatment. So I hope that you go through some of these photo and my journey with me. The content for today is the need of integration we'll discuss, and we'll discuss some clinical steps in integrative oncology. We'll talk about circulating tumor cells and what is cancer stem cell. Talking about chemosensitivity testing, blood extract testing, and also the use of Mistletoe herbivorous in oncology. And we can also talk about immunotherapy like GCMAF, injection oral capsule. We also can talk about steps and schedule of integration cancer treatment. Myself from Malaysia, near to Subang Jaya. It's a town that's 20 minutes away, and this is my team. I run a center. And why is there a need for integration in cancer treatment? The cancer statistics every day now, 25,000 people die around the world. That's equivalent to about 50 jumbo jet plane crash. So every day. If you know jumbo jet plane crash, so it's a big thing. So why is that so? Because cancer, they outsmart us always. Cancer, they can outsmart us easily. They can grow, and then cancer cells are very different size. They grow, and then they don't stop dividing, and then they are destroying surrounding tissues. And then within the tumor, you can find different level of blood vessels and a lot of cells. So whenever you detect a tumor, there's so many cells inside there. And this is apoptosis. Usually our body would have a healthy cell and then divide. The moment something wrong, then the cell will go into self-control death. There are many cells that is not dying. When they are not dying, then they become tumor. What is the situation of a cancer patient when they come to us? The immune system is down, organ function is down, mental health so-so, diet not so good, lifestyle maybe not so good, quality of life of course sometimes good, sometimes really bad. After having chemo and radiotherapy, what happened to the immune system usually? It's even worse, and then organ function down, okay, mental health further down, diet down, okay, lifestyle even worse, right? Then quality of life even worse. So what is the ideal way of what is the ideal treatment that a cancer patient should receive? The ideal one is boost up the immune system, boost up the organ function, mental health increase, diet to improve, lifestyle to improve, quality of life to improve double. That is not so in the allopathic world. The options that we have, surgery, chemo, radio, it's not taking care of the immune system. The disadvantage is that we're not trying to change the cause or the risk factor. We're reducing the life quality rather than improving. And we're not dealing with lifestyle factor, protocol therapy, and it's not individualized. Most of the treatment in the hospital is protocolized, it's not individualized, it's not personalized. So the main goal is treatment. There's no preparations or aftercare. So that's the conventional thing that we talk about. So therefore, the integration is important. So have you ever wondered chemotherapy the first time it will always work? It's because when you have a tumor, there's always a cell that is good and cell that is bad. Cell that is sensitive to chemo the first time. So first round of chemo, of course, all the sensitive cells die. And then the leftover are the resistant one. And then the next time when the tumor grow again, the same chemo won't work, so that's a chemo resistance. So with chemo and radiosurgery, what's going on is that radiotherapy is a dangerous side effect, long-term bone marrow depressions. It causes a lot of difficult to treat, such as nausea, vomiting, and weaknesses. Both of these methods is not very effective. So the huge problem is development of the chemo resistance. So the traditional hallmark of cancers that we know, all of us, that is the hallmark of cancers are avoiding immune destruction, regulating the cellular energy. So if you want to ensure conventional successful treatment, you need a lot of intrinsic therapy, immunogenic. We are supposed to induce immunogen and then causing the cell death, and then causing the immunogenic signals, and then tumor infiltrations. We need immune effectors going into the tumors rather than going out. So that is on the right side, you can see there are many ways that the conventional treatment would fail in all these areas. If any time there is one step that is failing, then it will go into therapeutic failure. Therapeutic failure, aka chemo resistance. So we're not reducing that all around the world. The cancer rate is not dropping at all. It is shamefully saying that it is not effective. But what is the health span? Cancer happens at the degeneration phase here. Our health span after 30, 35 years old, they say after 25 years old, aging starts to happen. This is 20 to 25 years old, aging starts to happen. Especially from the age of 35 to 60, this is the age of a degeneration. Whenever there's a degeneration, as our body regeneration decreases, the cancer will increase actually. This is the incidence of cancers. It is directly proportionate to degeneration and then inversely proportionate to the regenerative power. So optimizing the micro and the macro environment, treating the terrain rather than just attacking the tumor is what we should really focus on. The nutrition, exercise, proper sleep, circadian cycle, making the soil inhabitable for tumors. This should be the way to go into those. Health span expansion is important. For example, these are our body functions. We can actually expand this functional life so that the degeneration can be pushed away rather than in the front. So integrative medicine, what should be integrated? We should talk about not just disease, how it happens, but we want to go into salutogenic concepts. Salutogenic concept focuses on healing process and lifestyle and stimulation of enabling the body to heal from inside out rather than just blocking things, you know. Focusing on holistic quality orientations and process and time and dynamically doing integral, the whole body thing rather than just a local thing. It's a systemic thing, and it's a combination and combined, and we should do as much as possible rather than just as much as necessary. So that's the conclusion of this. Total health recovery comes from a short-term, medium-term, and long-term. The short-term is looking at diseases, sickness, okay, and then we should also understand when a person with tumor, there is a disease inside them. Yes, we want to kill the tumor, but we don't want to kill the patient. We also want to understand the body need to be supported. The body, if you have one organ down, you can recruit another 11 organs to help the other one organ to heal. So organ recruitment, organ support is important. And then find a long-term 2 to 5 years or even 10 years program for the immunity to happen. So in our center, we have what is a good, proper anti-cancer program? It's a cancer treatment, of course, we want to kill some tumors, but immune support is there, and organ support, diet, education, exercise, and detox program. Majority of the patients who come to us with the tumor, they're somehow intoxicated. They have amalgams, mercury, and all these heavy metal toxicity. So many toxins are in the body. So, of course, the main killing, it should be tailored to killing and cleansing, killing and building the body. Just not just always everyday kill. It's just that killing the cancer cells can use proteolytic enzyme, low dose chemo, IPT, heat, fever, ozone, artesunate, DCA, Mistletoe Therapy, and then high dose vitamin C, high dose selenite, and then herbal nutrition. These are all areas that we can target and use holistically and integrate it together for killing the cancer cells. And how do you ensure a strong condition? We can do supportive therapy such as dieting, teaching the patient about keto diet, ketogenic diet, low carbs, high on healthy fat, educate the patients, not just the patient, but the family to work together, and then give a lot of nutrition and herbal for organ support, and also improve their nutrition and exercise, and also to prevent cachexia. Boosting the immune system can use heat therapy, can use GC-MAF, this is an immune stimulant, oral capsule, and cell therapy, peptide therapy specifically to stimulate the immune in long term. What is the clinical step in integrative oncology? Actually, number one is to analyze the body, the cancer properly, know the enemy. Number two is to know your body, to clean and build the body, to document the deficiency, toxicity, and acidity properly. Number three is to revive and restore the immunity to develop a long-term plan. So it's a short-term, mid-term, and a long-term plan. Knowing the enemy, the cancers, knowing your body, and then building a long-term immunity. So how do you analyze the cancer properly? How do you know the enemy? What is circulating tumor cells, CTC? What is the cancer stem cells actually? Whenever there's a tumor growing, there is extravasation here. Intravasation into systemic circulation called the blood or lymphatic is called EMT. From the EMT, the cells can stay in the blood-lying domain for a few years. And these there's cancer cell that's circulating in the circulation is called circulating tumor cells, and then they have CSCs, cancer stem cells, certain surface marker you will be able to know. And they're waiting for time for you to, for them to extravasate again from the MET. That's why they call metastasis. Metastasis means mesodermal, ectodermal transitions. So usually you will see the aggressiveness come from the secondaries. Because the development of solid tumors start from 1 year, 2 years, 3 years, 4 years, it grows into millions and billions of cells. It takes years for the primary to grow, but whenever the metastasis is happening, it can be very fast. Fast-growing tumor doubling time is 36. Longest time, maybe 100 days, 130 days. So you will often see the secondaries is the one that kills, and many cancer patients die from the secondaries problem rather than the primary. So 100 breast cancer patients, 90 is without metastasis, but 10 is already with primary metastasis. And 25% develop metastasis during the next 1 to 5 years. Others will develop metastasis during up to 30 years. So the moment we discover certain patient with tumor in their blood, there is already circulating tumor cells, there is already many tumor stem cells, these cancer stem cells staying there, and it is worth targeting this area and reducing these numbers. So lots of studies are talking about the increasing of the cells number in the circulating tumor cells is increasing, the prognosis gets worse. If the numbers is reducing, then your treatment is correct, and then circulating tumor cells, you can count them, you can catch them, you can do phenotyping, you can understand whether they are going into apoptosis. So if you want to kill the enemy, kill the queen, kill the king, not just chasing after the dog's tail actually. So increasing cell number correlates very highly significant with the poor prognosis. So this is the poor prognosis survival for patients if the numbers of the circulating tumor cells increase. We have been drawing blood to send to Greece, the RGCC test, to talk about the sample report. This is actually the numbers. The numbers is at the bottom. They would count the numbers, and then there is this surface marker. Because tumor cells are epithelial cells, they have epithelial cam, this positive. We can also understand the stemness. What is the stemness? This most important thing in the CTC test is not just the numbers, but the stemness. The nanox, substu, OCT3, and then 133, CD133, CD44. These 5 items is actually the stemness, the aggressiveness of the cancer stem cell, which is a hallmark of the cancer stem cell. And the same report can tell us the CMAT. The CMAT is actually a marker that is expressed for the aggressiveness of metastasis. So the test will come back with multiple. What do we do? We draw the 5 cc of blood we throw, and then we draw the next 25 cc into the tube, and then let them sit the plane, go to Greece, and then they will do the test. And they will actually catch the numbers and count, and then they will do phenotyping, and they will tell you what kind of cells you're dealing with. Just like you go into a post office, you pick up a post, you know the parcel is from where and going where. So after that, they will culture it into 125 vials. Half of the 60 vials, they will do all this chemosensitivity. Another 60 vials, they will do the plant extracts. So you do not need to shot in the dark actually. These are all the other chemo items and all the cytotoxic items that you can be able to use. And the report is from the onconomics, you are able to find out all the sensitivity. If you want to choose any chemo items, you can choose those that is more than 80%, the high sensitivity, because it causes instructions. So you do not need to just follow the protocol, but you can actually individualize your treatment. And there is also a genetic test talking about the resistance of the report. So this is all the Zumab. There is a Zumab test as well. All the TNIP is all here, the testing as well. It can also tell you the high risk of the gene repair and then the growth factors. It will also tell you the hormone receptors, and it is also telling you the heat shock protein, HSP. Heat shock protein is the indicator for the tumor being sensitive to radiotherapy or the hyperthermia at all. So when the report is out that we can use these markers successfully to do treatment, and especially useful are those plant extract that you can see they are testing on B17 artesunate, they're doing on D3, DCA, poly-MVA, salicynum, superartemisinin. Mistletoe is here, fucoidan, Timex is all here. And this is class 3 PK, genistein, quercetin, indole 3-carbinol, and vitamin C also is being tested. So there will be summary. The summary is coming out, and then with class 1, class 2, and class 3, this report. With this report, you can actually do a lot of follow-up, and you can plan for systemic treatment. You can catch the tumor cells and stop them in the cell cycles accordingly. So there's conventional agent, there's natural substance, there's targeted therapies. So you can follow the algorithms and to develop a very successful treatment for the patients after doing these tests. Usually there is a large scale of mistletoe and all these items is in the natural therapy range. It depends on the choices of the patient. So this is the immunostat talking about immunity. You can even find out the TH1, 2, and 3 of the condition of the patient. You can do additional helixal-M testing. You can find out whether it is inducing the apoptosis. THC is the cannabinoid. You can also do Boswellia testing. You can also do thalidomide. You can also do GC-MAF testing as well. So increasing cell numbers will correlate with the poor prognosis. So with the test, we use album. Mistletoe has been a very long history. The mistletoe is an item that is already with proven successful rates to kill cancers and also to induce apoptosis and to do treatment. Around the world, mistletoe has been discovered a long time, and it has a lot of items inside the mistletoe. It's a viscotoxins, and these are the items that is inside. Some of the items are not well yet to be discovered their functions, but it has been the most studied item that is useful for tumor. So the effect of viscous album is cytotoxicity, immunomodulatory, direct induction of apoptosis, and inhibition of angiogenesis, multiple usefulness. And it can fight the cancer-related fatigue. You can also you can use it as a subcutaneous. You can also intravenous. You can also do intratumoral, intrapleural injections. This is the immune stabilizations of VAE. So it can be combined with chemotherapy as well. It is the safety of Helixor is very well known for many end-stage or whatever stage tumor patients. They can actually tolerate this very well. One of the great things that is about viscomabum, the Helixor, mistletoe therapy is this bone marrow direct stimulation as proved in the CT scan, and it is the anti-angiogenesis, the reduction of the vascular blood vessels that is being proven, and the tumor is shrinking after few usage. It is also often effective in palliative. It is the only item that you can use for curative and palliative all the way, from aggressive and to non-invasive. So improved quality of life in fatigue, insomnia, in appetite and pain and nausea is all well proven. And intratumoral injection has been really successful. Intrapleural as well, that I've been using it. And last year I have been presenting a case of intratumoral injection, large tumor that is at the sarcoma area that we have injected, and the tumor actually is a huge sarcoma that it has shrunk. This is appearance on the left inguinal area. We use 3 methods of doing Helixor for subcutaneous stimulate the immunity, such as this, and we track the fever pattern for this patient, temperature monitoring, and we do once a week Helixor infusions intravenously, slow dose, and we also do intratumorally high dose injections because the tumor was really huge, and the tumor was threatening the limb. So this is the result after the few injections, first, second, third, fourth, fifth injections, and then the tumor size continued to shrink even after the treatment is stopped and the patient is returned to work. So the intratumoral injection of Helixor P successfully reduced the inguinal tumor from 11 cm to 7 cm. What are the other successful factors of optimizing patient outcome? Is the detailed health checkup, and then looking at the body from all other. Besides that, from the report back, we've been using artesunate as well. Artesunate is a sweet bone move. You can do research on artesunate, artimeter, and also artesunate is the active format of artesunate. It is usually very effective for many resistant tumors. Chemo-resistant cell line, fast-growing tumor cell line. Colon cancer, mammary cancers, melanoma, usually is even intramuscular and also intravenous. You can give intravenously 150 milligrams to 300 milligrams every day, intravenously over 21 days. So some cases that I can present is that thousands of CA125 dropped down to 32, and then disease stable for 6 months. And DCA has been an item that we have added into our treatment for patients as well. In DCA, we can research about the protocol, how to give DCA intravenously. Below is the 21 days therapy schedule in our center that we subject the patient to come every day, about 4 to 6 hours day care. Then they will typically flow through the treatment from the ozone, from the non-invasive to the invasive, and then break lunch, and then they will do more treatment. And this is the IV therapy that is intensively done. And these few patients is still under follow-up in our center. This is after they do the test, and then we have, based on the sensitivity, we tailor these 21 days anti-tumor schedules for them. This is a renal cell carcinoma male patients with, looks complicated, but actually patients spend 4 to 6 hours a day in the daycare, and every day they come. Before they come, they do detox at home, and there are lots of things that they do even after they go home. So, all right. So, how do we know ourselves? We want to document deficiency, toxicity, acidity. We subject the patient for some tests, hair profiler to find out the body organs, and do a live blood examination for their toxicity. We also look at their amalgam, trying to remove and do exchange for them to reduce the, because every diseases have a tooth root to the tooth problems. So this organic dentistry is important. We clear these mercury amalgams for them, and we send to biodentists. We also document the heavy metal toxicity by oligoscan, and we also do oral urine challenging metal test. This is the oligoscan that you can see their minerals, and you can see their heavy metals report out, and we, based on these few reports, we can actually develop a holistic game plan for the patient the next 2 to 5 years. The foundation of optimal health is delivered to the patients, teaching them how to use, protect the cells by using the hormones and also the supplements and juicing. The hormone is the thyroid. Usually we correct the thyroid deficiency, adrenal deficiency, and also hyperestrogenism. We look into those things. Detoxification, the colon and the liver, and then dieting and the exercise. And we also convey this message to the patients, talking about short-term, middle-term, and long-term. Most of the patients, they do not make it in their, and then we teach them about the leaky gut and try to identify the leaky gut issues, and then we fix the gut and then do the liver flush, and IV therapy, nutrition, chelations, and also fix the thyroid, of course, and mitochondrial resuscitations. Glutathione as well is a very important nutrient for the to generate energy. Actually, most of the patients, when they come to us, they're very low energy and very tired. Mitochondria failure, mitochondriopathy. We actually also want to document their acidity. How do we do that? Is saliva test and urine test for the pH. Actually, it's pretty simple to test the tissue toxicity, the tissue acidity by doing a saliva test. Use a universal pH tester would do. How do we restore the immunity in long term? Actually, I have a chance to fly to Osaka to visit Saisei Mirai. I met Dr. Toshio. Dr. Toshio is the founder and also discoverer for this Saisei Mirai lab that he is the second generation and third generation GC-MAF developer. It's actually a very exciting add-on to our arsenal. The GC-MAF has given a lot of it is actually the first line treatment for reviving the gut and also reviving our basic first line of defense. So actually GC-MAF has been proven successful to improve NK cell and also DCs, dendritic cells in the second generation and the third generation on this. The second generation is by injection, the third generation is by capsuling. Choline toxin, Dr. Toshio is also using choline toxin for intratumoral injections, and I had a chance to see him doing that, and I think I can't wait to learn from the doctors here that they're going to present maybe about the choline. The choline toxin is also a fever therapy. We have expert fever therapy, Dr. Steven, right? Yeah, and yeah. So this is their strategy talking about the GC-MAF immunotherapy and local control. What are the other complementary and integral wholesome treatment that I do in our center? We do modified Gerson treatment, improving the water salt management, improving their potassium, reducing their sodium, helping the patient to detox and then generate energy through iodine and then nutrition. And of course, we fix the gut so that the immune system can be rebuilt. We also want to clean up the ear and the ENT area for potential opportunistic infection. We want to reduce the distraction of the body of the patients from healing. We also do EBU and ozone treatments for stimulating the immunity. That's the Ozone Forum of India talking about oxygen usage. Yeah, this is a slide talking about how the most important thing about ozone is to restore the non-specific cell-mediated immunity, which is the first line of defense. The second line of defense is a specific cellular immunity mediated. The humoral system is always overactivated, so we want to restore the Th2 back to Th1. So the Th1 is the one that is actually involving the NK cell and also the APC. And ozone is the one that really can very quickly and also very cheaply to reduce the over-inflammation and to promote healthy inflammation and first line of tumor. And it gets rid of a lot of chronic infection. Maybe more than 80 to 90% of my cancer patients, when I do a virology for them, there are a lot of CM. They have infectious mononucleosis and they have very high Epstein-Barr viruses. So if you can help the patient to overcome this virus infection, which is a hidden one, and their immunity is able to be focused on cancers rather than opportunistic infections. So relieving the patients from chronic infection is one of the big things that we should also focus on when we want to help the patient from stage 4, stage 3 to recover. This is the way we do ozone blood wash in our body called the EBU. This is EBU in oncology. This is one of the end-stage pulse electromagnetic field therapy in our center that we do on sarcoma, big tumors, and also large tumor, for example, multiple lung tumor that can be reversed actually.